Hi, everyone. Hi.
Hi, how are you?
I'm good. How are you?
Great, so excited to be here.
Yes, we're glad to have you here. I guess we can wait maybe 2 more minutes and then we can get started.
Okay, awesome.
How's your day going?
Great, great. It's a cold one.
Yes,
DC is, the temperature is dropping, so we had to
yes,
bring out the heavy
definitely.
jacket.
Yes. I'm kind
Hey
of
to
excited.
everyone joining. Thank you so much for being here. I'm loving your hair.
Thank you. Thank you. This is like something done quickly. Like thank you so much. I like yours too. I love the slick back look.
Gotta do it, gotta do it. You know, the winter time is great for natural hair, so
Yes.
I love all the different styles.
Yes, definitely.
I
Definitely.
see some of my sorors in the chat. Hi, everyone.
Hi. Okay, so I guess we can go ahead and get started. We have 11 people in here now. So I guess I'll go ahead and introduce myself. My name is Moody. I'm a community health outreach specialist at Whitman-Walker. My pronouns are she, her. Shannon, you want to introduce yourself?
Okay, hi. Hi, everyone. My name is Shannon Anderson. My pronouns are she, her, hers. I'm a member of the Washington, D.C. Alumni Chapter, the International Awareness and Involvement Committee of Delta Sigma Theta Sorority Incorporated. Each year, we take the time to commemorate World AIDS Day, and this year, the 2020 theme is Rock the Ribbon. So we are rocking the ribbon today to spread awareness for World AIDS Day yesterday. So we are so excited to be here to discuss with you and spread awareness of HIV and AIDS. So thank you.
Yes, thank you for collaborating with us today. As you all know, yesterday was World AIDS Day, and we are here again to raise awareness about HIV and AIDS epidemic. And today we have a specific focus on the epidemic and how it affects Black women. We will share data, preventative measures, risks specific to Black women, and answer any questions that you all may have. Check the pinned comment below to access free HIV STI testing at Whitman-Walker Health because it's very, very, very important to know your status.
Yes, definitely. All right. So Seisha, could you give us some stats on HIV for Black women in DC?
Sure. I'll share some general info and then get into specifics. The following stats are from the 2020 epidemiology report from DC Health. 12,408 current residents of DC are living with HIV. This is 1.8% of the population in DC. Of this number, Blacks and Latinos with HIV exceed 1% of their respective populations, with Blacks disproportionately impacted at 2.8% of their respective population. More than half the people living with HIV in DC are 50 years old and older. Between 2015 and 2019, young people ages 13 through 24 represented nearly 20% of new HIV diagnoses. Most people living with HIV reside in the wards 5, 7, and 8. In 20 of those 12,408 current DC residents living with HIV, 3,292 of those are Black women. This is 1.7% of the population. 16% are Black heterosexual women. 4% are Black women who use intravenous drugs or IV drugs. In 2019, there were 282 newly diagnosed HIV cases. Of the 282 newly diagnosed, 61 were women. This is 21.6%. 9 in 10 were Black women, 3 in 10 were aged 50 to 59, and 1.3% of women living in DC with HIV had a chlamydia diagnosis in 2019.
Wow, thank you so much for sharing that data, Seisha. Those numbers are truly alarming. And just to hear the last statistic really stuck with me, that 9 in 10 of those newly diagnosed HIV cases were Black women. So this just goes to say that we need to be aware of this and take care and take heed to our sexual health. So thank you so much for sharing this. Could you tell us a little bit, what does it mean to be high risk for HIV and AIDS?
Okay, so the risk of getting HIV, it varies widely depending on the type of exposure or the behavior, such as sharing needles or having sex without a condom. Some exposures to HIV carry a much higher risk of transmission than others. Factors that may increase the risk of HIV transmission include sexually transmitted diseases, acute and late stage HIV infection, and high viral load. And I'll share a few of the risk factors that were identified in DC Health's 1 in 10,000 risk exposure chart. Needle sharing during injection drug use was one, receptive anal intercourse, receptive penile vaginal intercourse, receptive oral intercourse, and insertive oral intercourse. Of those, receptive anal intercourse was the highest risk of transmission, and needle sharing during injection drug use was the second highest.
Wow, wow. Thank you so much. I saw in the comments, we were particularly interested in seeing the different breakdown on the wards and also seeing the different risk factors for HIV and AIDS. It's so important to know if you or me or one of our friends, family do count as high risk. So thank you so much for sharing that. Now that we've shared data and risk, we've covered that. So could you tell us a little bit about how Black women can lower their risk of acquiring HIV?
Sure. So factors that may decrease the risk include condom usage, male circumcision, antiretroviral treatment, and PrEP or pre-exposure prophylaxis.
Awesome, awesome. Could you tell us a little bit about PrEP? Could you describe what it is and also some common misconceptions with PrEP?
Yeah, sure. So PrEP stands for pre-exposure prophylaxis. It's a daily pill that you can take that prevents HIV in both men and women, and it's over 92% effective. So simply put, it's like birth control for HIV. So now get into some common misconceptions about PrEP and PEP. So we're going to do a little game of true or false. Shannon and I will read off some statements, and you all can type T for true if you think that it's true, or F for false if you think that the statement is false. So you want to start, Shannon?
Okay, I'll kick it off. All right, so only people who are HIV negative should use PrEP or PEP. Let's see some T or Fs in the chat to see what you all are thinking. I'll give you all a second. Okay, my comments are loading slow, so I'll just read the response. So that is true. Only people that are HIV negative should use PrEP or PEP.
Yes. So the next one says you don't have to be tested for HIV and have a documented negative test result before starting PrEP. True or false? Right? T for true or F for false?
Okay, I'm seeing some Fs out there.
Oh, give me a second to pin this comment, please. I'm sorry, guys.
Thank you so much for participating. We appreciate your answers. Please keep it going. I see mixed 50-50 T's and F's for this last statement here. So Seisha, I'll just keep going while you.
Yeah, that's fine. That's fine.
Yeah,
I just don't want to.
While you pin the comment. So all those F's out there, the statement was false. You don't have to be tested for HIV and have documented negative test results before starting PrEP. So awesome to all those who got that right. But we
The sound. Can y'all hear us? This is still no sound. Okay. So let's see if I'm gonna send a request back to Shannon to get her back on the live with us.
can you all hear me?
Yes, okay, definitely.
Awesome. I learned my lesson of these with the versus challenges in tuning in. So all right. So I believe we were on the third statement. So thank you all for bearing with me. I apologize about those technology issues. Okay, so PrEP and PEP are available over the counter. Let's see some T's or F's in the chat. Let's see. I see a thumbs up. F, okay. All right, so whoever said F out there, okay, that you all are correct. So that is false. You cannot get PrEP or PEP over the counter. You have to go through a physician, okay? Seisha, do you want to take the next one?
Sure. Let's see. So PrEP and PEP do not protect against other STIs or pregnancy, and they are not cures for HIV. True or false?
Let's see. Okay, so there's some T's coming in. Nice.
Yes, so the answer is true. PrEP and PEP do not protect against other STIs or pregnancy, and they are not a cure for HIV. It's just simply a preventative measure.
Okay, awesome. All right, here's the next statement. So PrEP is more than just taking a pill every day. It also involves frequent medical visits and lab tests to check for HIV, other STIs, and any changes in kidney health. So let's see some T's or F's in the chat. Thank you all for participating. I'm learning something as well. This is awesome. Okay, there are some T's out there. Nice, nice. You all are on point. You all are on point. So yes, so that is true. You do need to have regular, medical visits with your physician to check lab results, to check for other STIs, and also to check your kidney functions. Awesome.
So the next one is PEP is taking, or PP is taken for 18 days. True or false?
That's a tough one. Saw some
See
T's.
some T's. Somebody, I see an F, false. Okay.
Okay, I see majority false out there.
So that is correct if you chose false. PEP is actually taken for about 30 days.
All right, awesome. So let's keep it going. The next statement is PrEP does have to be taken forever and can be stopped at any time under the supervision of your medical provider. True or false? That's a tough one too. Let's see what you all are thinking. Okay, I see a hello. Hey.
Hi.
Let's get some T's or F's out there. Okay, I see an F. Another F. Nice. All right, I see a majority false. And you all are correct. So it is false. You do not have to take PrEP forever. So that was an awesome statement. Let's go on to the next one.
So the next one is if you've used PEP in the last year, it might be a good idea to talk to your medical provider about PrEP. True or false?
Let's see.
Have one true. Let's see another one.
I think some people are thinking out there.
Mm-hmm.
Nice. A lot of T's. Wow, a resounding reaction from the T's. Awesome.
So yes, the answer to that is true. If you use PEP in the last year, it would be a great idea to talk to your medical provider about transitioning into getting on to PrEP. And we offer PrEP at Whitman-Walker. I didn't expound on what PEP or PEP was, so just want to go and let you all know what that is. PEP is a post-exposure measure, is in comparison to PrEP, which is a pre-exposure measure. So if you had an encounter one night and you feel like you may have been exposed to HIV in that encounter, you could contact Whitman-Walker, or you could go to the nearest emergency room within 72 hours of that exposure, and then you can get PEP, and that can potentially prevent you from contracting HIV during that exposure.
Thank you so much, Seisha, for that clarity. I realized that we kind of jumped into the conversation and didn't define those things, so that's awesome. So thank you so much for everyone that participated, and also for Seisha again for that great information. It sounds like PrEP is an awesome tool for HIV prevention, especially for Black women and quite frankly for everyone. So let's just check the chat for some audience questions. I know the true and false was very stimulating and may have prompted some questions in the chat. So if you all don't mind, just write in any questions that you may have for Seisha or myself. And let me see if I can touch my phone without disconnecting to audio. Any questions out there?
I see. Will this be posted on your Instagram feeds? Yes, this will be posted on Whitman-Walker's Instagram feed. I'm not sure, Shannon, will it be posted on?
Yes, it will be posted on the WDCAC DST page for further, so you can come back and visit this information, and it will also be shared on Facebook as well for those on other platforms.
And
yes, I would love to rewatch. Yes, this has high rewatchability value. I think we all took away some valuable information from this.
Let's see.
Seisha, if you don't mind, I have a question.
Oh, okay, go ahead.
Oh, I actually will answer this one first. Is there free HIV testing at Whitman-Walker? I actually had the same question.
Yes, we do offer free HIV and STI testing. We do free rapid HIV testing as well as a free test for syphilis, gonorrhea, and chlamydia. We're doing testing appointment only at the moment due to COVID. So feel free to give us a call at 202-797-4439 to schedule an appointment with us.
Okay, awesome. There's another question. Is there a difference between PrEP for men and PrEP for women? Awesome question.
So PrEP is essentially, it's the same medication for, well, it's not the same medication, but it's the same process for men and women. There's different versions of PrEP medication, so some may not be applicable for a woman to take because of them still doing research on certain medications such as Descovy, but Truvada is a measure that women can take.
Awesome. I saw a question in the chat. Are there any side effects to this, to PrEP or PEP? Another awesome question, and we see that from the Whitman-Walker page that there are not major side effects. But just to chime in on that, one issue, I guess, with PrEP is that it could lead us to maybe have false confidence to not get routine testing for STIs or STDs. So although that is not a side effect as far as affecting our organs, however, it could have some downstream effects. We definitely want to make sure to keep up to date and have routine STI and STD screening. So thank you for that question. We have a couple of minutes left, so would love to see some more questions in the chat, or if not, I have another question in my back pocket.
Someone said, does PrEP make you less contagious? So taking PrEP medication is strictly to prevent you from contracting HIV if you had an encounter with someone who was HIV positive. So it won't make you less contagious. It's just strictly a preventative measure.
Awesome. Is the testing private?
Yes, it is confidential.
Awesome. These are some great questions, everyone. We are all learning together. This is really awesome. And just to comment about the last question about whether or not PrEP makes you less contagious. So that statement actually has more to do with if you do have HIV or AIDS, you would be taking your HAART therapy. That's just an acronym for a group of medications that you would take. And so those medications would decrease your viral load, or in layman's terms or regular conversational terms, make you less contagious there.
Right. Mm-hmm. Let's see another question. Thank you, Sophia.
Yes.
Someone said, is it covered by insurance? Well, covered by insurance for meds. So are you asking, I assume you're asking, is PrEP covered by insurance? So it can be covered by your insurance. It just really depends on which insurance you have. And at Whitman-Walker, we have a public benefits department that you can contact to make sure that you would be covered by your insurance for PrEP.
Okay, and is PrEP contraindicated in pregnancy? That's an awesome question, since we are women here.
I'm not 100% sure. I believe so, but I would definitely check the CDC website to be sure about that.
How does PrEP interact with other medications for autoimmune diseases such as myasthenia gravis or leukemia? That's an awesome question. Seisha, do you have a take on this one?
Does PrEP interact with other medications? Okay, so I'm not 100% sure about that either. I know that it does have effects on your kidneys and liver. So whenever someone wants to start on PrEP, they have to get a lot of metabolic work done, blood work done to make sure that they would be a good candidate. So that's definitely something that you would have to discuss with your doctor.
And I see there is this conversation not trans inclusive or just for cis women? That's another awesome question. Seisha, do you want to go ahead and respond to that first?
So PrEP is for anyone. Everybody can take PrEP. It's there's methods for PrEP for everybody to take. So no, it's not just this is not just for cisgender women.
Yeah, and some of the stats that we read out earlier kind of touched on men, women, people, and can affect people that can use they pronouns, transgendered women or men. I believe this information can definitely help all of us. What percentage? I'm losing the comments. My apologies. Okay, what percentage does PrEP prevent you from contracting HIV? I think, Seisha, we mentioned that number earlier, but it would be great to just cover that so we could hear that takeaway.
So PrEP is 92% effective against preventing somebody from contracting HIV.
That's great. That's great. I mean,
and I see somebody says I haven't heard trans. So PrEP can be taken by trans men and trans women.
because it requires a prescription, are there any ways that Whitman-Walker is making it accessible? Awesome question.
So we, like I said, we offer PrEP. You can give us a call at 202-797-4439 to get in touch with someone to put you in, make you an appointment to get PrEP. We have a location in Southeast Anacostia, our Max Robinson Center, and you can make a medical appointment to meet with somebody there as well to get started on PrEP.
Let's take one more question and we'll close out. I see it's about 7 o'clock.
Mm-hmm.
My internet is giving me challenges. Do you see another question out there, Seisha?
Yes. What is U equals U in relation to HIV? Sorry if I missed this. So no, you didn't miss it. We didn't discuss that. So U equals U stands for undetectable equals untransmissible. So undetectable is a term that is used to break stigma against HIV positive individuals. So if someone is undetectable, their viral load has dropped so low that they no longer can transmit HIV sexually. So it's just something to keep in mind. And that's done, you become undetectable by taking your medication as regularly as prescribed by your provider.
Awesome. Awesome. Thank you all for participating. Seisha, do you want to close us out and give us some final words?
Sure. So thank you all for joining. we can, like I said, you can access PrEP with us or PEP with us at Whitman-Walker. You can give us a call at 202-797-4439 to get in touch with a community health educator and schedule your next HIV and STI test.
Awesome. And thank you, Seisha. Thank you, Whitman-Walker, for allowing Washington awareness and involvement of Theta Sorority Incorporated to be involved in such an awesome effort. Tonight, we rock the women to honor those affected and lost by HIV and AIDS. So thank you for this opportunity. Join WDCAC DST every first Wednesday at 6:30 p.m. for more discussion. The next topic that we'll be having is the body image effect. So tune in next time. Again, Seisha, Whitman-Walker, thank you so much. This was phenomenal.
Thank you. Thank you so much for joining us on this special Women Wednesday segment. We look forward to continuing this collaboration with Delta Sigma Theta Sorority Incorporated and prioritizing our communities in the fight against HIV/AIDS. Make sure to follow us on Twitter, Facebook, and Instagram at Whitman-Walker and also at Real Talk DC _ to stay up to date with all things Whitman-Walker Health. And be sure to give us a call for your next HIV STI test.
Thank you.
Thank you. Bye, everyone.
Bye.